This is Coach Tess from HealthEversity, and today we are going to be focusing on modifiers. This series is going to be focusing on CPT modifiers for the CPC exam. So let's jump right into it. So this is the intro to modifiers, okay? So let's go with this presentation. Okay, so it is the CPC exam modifiers. So again, and now we are focusing on modifier 23 for the CPT board examination. So let's jump right in. See, I have my purple marker, or highlighter, what you call it, and this helped me with my notes, and this will help you, and it's pretty colorful, okay? So let's jump right into it. All right, modifier 23, unusual anesthesia. Unusual anesthesia. So here are some of the keywords. Unable to tolerate without general anesthesia. Okay, so these are some of the, this is the main keyword for modifier 23, unusual anesthesia. Also, this one is really short, but we're going to jump right into it. All right, modifier 23. Modifier 23 is used for procedures that would normally not require general anesthesia. So let's try and pick up a story on this. So let's say somebody went in for like something on a real minor procedure that does not require general to put them to sleep, but they could not tolerate it, and then they say, oh, we need to put it to sleep. So that's when you have to do it, and that's when they have to document the reason for them using general anesthesia. They can't just put it to sleep just like that. The procedure, it has to be medical necessity. Okay, so it's not applicable for local anesthesia. See, it's not applicable for moderate conscious sedation. Okay, so you can't be half asleep and they just give it to you general anesthesia. Nope, you have to, it has to be needed. Okay, codes, so moderate sedation codes 99151 to 99153 and 99155 to 99157. Modifier 23 should not be reported with codes that include the description of without anesthesia. So this is a keyword in the code description you have to pay attention to. The documentation should indicate why the anesthesia was necessary. So you have to make sure that once you're a coder, you and the doctor forgot to write it, you have to query the provider and let them put it back in the notes. Make sure this will increase your accuracy. Okay, so let's move on to an example. So here is a procedure right here, procedure code and how we appended modifier 23. Randy Hill is a patient with a psychiatric condition who needs to undergo surgery for a simple drainage of a finger abscess. Because the patient has much anxiety, that's the reason, this is the reason right here, about the procedure, the physician uses general anesthesia on him. So now see, that simple 3 words give the whole story. See, this is the diagnosis, psychiatric condition, right? And they're doing under surgery for a simple drainage, but they have anxiety, right? So now they had to use general anesthesia on him. So that is the reason, and we would code 26010 and we had append modifier 23. And there it is for modifier 23. Talk to you soon. Continue watching the series. will be focusing on modifier 24 for the CPC exam. So let's jump right into it. Modifier 24, which is used with CPT codes. Okay, so let's jump right into it. Modifier 24. Now, let's look on these highlighted terms. Now, unrelated E&M evaluation management by the same physician or other qualified healthcare professional during a post-operative period. The post-operative period is after the surgery is done, post-op, right? So it's unrelated, outside of, and not related to. So these are some of the key terms for modifier 24. Okay, key term, unrelated, same physician, post-operative period. Okay, all right, so let's move on to the next page. Okay, moving on with modifier 24. Keep moving, right? Modifier 24 is used with E&M codes only. So you have some modifiers only go with E&M codes. So it says it's only E&M codes only, right? A different diagnosis from one that required the surgery is necessary to support the unrelated E&M service. Okay, use modifier 22 if the qualified E&M service is performed during the 10 or 90-day post-operative period. So it has to be medically necessary. Why are we doing this procedure while that person just did that surgery? So we have to make sure it's documented correctly, and I'll keep saying that, okay? A different diagnosis from the one that required the surgery is necessary. See? It looked like a kid's book, but I like doing it like this, so it's easy for you to read and understand. To support the unrelated E&M service. All right, so let's move on with the next page right here. Okay, so use modifier 24 if the qualified E&M service is performing during the 10 to the 90-day post-operative period, right? If the diagnosis code, ICD-10, from the E&M service clearly supports that the visit was unrelated to the initial surgery. So it has to be totally different. Like, let's say somebody was working on the arm about a cyst on their finger, and now they have a cyst on their toe. It's two different things. Okay, so if it may be necessary to submit additional documentation. Okay, do not use modifier 22 when the encounter is outside of the post-operative global period. So it has to be within the post-operative period. Okay, do not use modifier 24 if the E&M service is performed by a different provider. Remember what it says, right? Let's go back for this paper. By the same physician in the post-operative period. So please be careful. Watch these keywords. So do not use modifier 24 if the E&M service is performed by a different provider who is outside of the same group that performed the surgical procedure. All right. So let's get to the question. So I have the answer down here. So let's read it here. Sally Monk had an open cholecystectomy 5 days after the surgery. She experienced chest pain and was seen by the physician who performed the surgery. He evaluated the chest pain. So now, see there? You have one procedure, but it's seen by the same physician right here. Same physician, okay, who performed the surgery. He evaluated the chest pain. So now, see, this is procedure 1, and this is other thing 2. So let's go back and look at this again. Unrelated E&M by the same physician right? During the post-operative period. So the post-operative period is 5 days right here. See it? And she experienced chest pain and was seen by the physician who performed the surgery. He evaluated the chest pain. So you have this one and you have that one. And we are going to use 99213 modifier 24. So we're moving on in the series of modifiers.